3. Hi, my name's Nicole Williams.
And I'm Jessica Kelly, and we're 4th semester practical nursing students at Georgian College.
For this class, Development of Nurse Within the Profession, for our assignment 3, we have chosen to do a toolbox. This toolbox includes 10 artifacts and 5 C&O documents, which we find most relevant as a new nurse graduate, based on our learning throughout all 4 semesters. So for our first artifact, we chose to do a drug chart. So this chart has all of the most common medications that we use on the floor that we're on right now. But as a new nurse graduate, you'd want to make another chart that had common medications that you used on that floor. To go along with the medication chart, we also have a pocket book, which has all the different medications that you could use that you might not have on the chart. We also have a cue card, which has just a few instructions of how to prepare a medication, including the rights to medications and the 3 checks before you give a medication. And lastly, we have another cue card, which has a few of the most common abbreviations for the medications. So we chose these because it's a quick and easy reference for a new nurse graduate on a floor. It's most important to know the medications as a nurse because you're responsible to have knowledge, skill, and judgment before performing a skill so that you make sure to perform it safely. So we want to make sure we know all of our medications before we give them to our patients. So for our drug chart, we learned about this in 3rd semester pharmacology, and we were able to apply it in practice during our 3rd semester postpartum rotation, mental health rotation, and our current rotation in our medical surgical placement.
Okay, so for the next item, we're using something to represent our head-to-toe assessments. The artifact that we'll be including in our toolbox is a pair of glasses. This represents the required observational skills as well as inspection, palpation, and auscultation, but we're representing the observation skills that are required for the attention to detail when you're inspecting a patient and looking at their overall physical well-being. Why we chose this is because it's essential in analyzing a patient's systemic state, and head-to-toe assessments include attention to detail and physical observation. Along with this item, we're including a head-to-toe assessment checklist. This is an overall detailed list of what we will be looking for when performing a thorough head-to-toe assessment. And next we have more in-depth cue cards on our neurological, cardiovascular, abdominal, and respiratory system assessments. Why this would be important for a new graduate nurse is to have quick reference to some aspects of head-to-toe assessment, because head-to-toe assessments are really essential in getting the full picture and understanding a patient's current state. For our head-to-toe assessment, we learned this in semester 2 in the health assessment class, and we've been applying it ever since through all of our practice.
So for our 3rd artifact, we chose to do communication techniques. So we have a poster here about communication techniques, which are essential for all nursing, but especially mental health, as it will help us to build a therapeutic nurse-client relationship, which is where our other artifact comes into play. This little sign, it says, "I believe in you." So it's very important for us to communicate with our clients and
build a supportive therapeutic relationship.
And our other artifact in relation to mental health is our mental status exam. So this is just a quick reference that we can use to help gather a mental status exam. So all of these artifacts are specific to mental health, which we learned about in 3rd semester mental health, but all of these can also be used throughout all nursing, as mental health plays a role in every type of nursing.
All right, for our 4th item, we are going to be including a Band-Aid in our toolbox. This Band-Aid will be symbolizing blood values. The reasons we chose this is because blood studies and knowing blood values is really important in nursing. So for this, we're going to be including a chart outlining the normal values. The reason it's important to know normal blood values is to get a better understanding of a patient's functioning and what's happening internally. This is important because we may need to check this to understand or to before giving medications to understand what's happening. As a new nurse graduate, it's very helpful to have an outline chart with all the normal values. The reason we would include this is because as a new nurse, we may not have all of the normal values memorized, and it is really important to recognize when something is out of defined parameters. So we are also including a blood test outline, which breaks down what tests are used to analyze the functioning of what parts of the body, which is also really important so that when you're reading your lab values, you know what it is reflecting. For our blood values, we learned this in semester 4 of Med-Surg.
So for our fifth item, we've chosen to include some gauze and pads and tape to symbolize wound care. So for our artifacts for wound care, we have our wound assessment, including our RITA assessment and our TACO assessment, which is so important as a new nurse to remember how to assess a wound so that you're able to document on it. So other nurses are able to see if it's improving or getting worse so they can determine how to treat the wound. Another thing that we are going to include is our checklist of the steps to completing a dressing change, although we know that every dressing change is going to be different depending on the type of wound. And our last thing we have is our Braden scale, because we know for each patient we're supposed to complete a Braden scale assessment depending on the facility. So these just say which each number signifies. So if you say that someone is completely limited, we want to make sure that we know exactly what this means before we rate that patient as that. So as a new nurse, it's just important that we know these things and have something to quickly reference when we are completing wound care. So for wound care, we learned about this in our semester 2 advanced healing arts class, and we've been able to use this skill so far in our OB clinical rotation as well as our Med-Surg clinical rotation.
So for our next item, we are going to be including an IV bag with a piggyback bag on top. The significance of this item represents our entire skills related to IVs. We are also going to be including cue cards explaining the details of secondary infusions, how to do an IV lock, discontinuing an IV, and signs and symptoms of complications. The reasons we're going to be including this is because it's really important for a nurse who will be doing like many IVs throughout a shift, presumably, to do these skills safely and competently. For a new nurse graduate, this is important to ensure proper technique. And at this stage of our learning, we may not have been exposed to a lot of skill-based practice, like hanging and starting IVs. So
it's just important to have these cue cards as a quick reference.
For our IV skills, we learned that in semester 2 in advanced healing arts, and we have been applying it in our OB rotation and currently in our Med-Surg clinical rotation in the hospital.
So for our next item, we've chosen to do something that's related to our OB rotation. So we've chosen to do discharge teaching as well as some specialized assessments for OB patients. So we have a cue card here that has our bubbles assessment, which is the specific postpartum assessment we do on a mother along with the head to toe assessment. We also have a teaching cue card, that has the teaching that goes along with our Bubbles assessment that we need to teach the mother. We have teaching during the baby bath that we can do with our mother, as well as a form here which just talks about a few breastfeeding tips. So this is important for us as new nurse graduates because OB is a specialized field, and although we might not be working in OB, we may still come across mothers who are pregnant or postpartum mothers who we need to care for. And we chose a baby as our symbol to represent healthy. So for our discharge teaching in postpartum, as well as our OB assessments, we learned about this in maternal child in semester 3.
Okay, so for our next items, we have isolation PPE. So the reason we chose this to include in our toolbox is because knowing proper isolation technique is really important in the prevention and of the spread of illness and disease. So it's important for us to know proper donning and doffing, the order to put on and remove PPE. So as a new nurse, it's important to remember this because it may not be a habit just yet, but it's important to start building those habits early on. And as a nurse, it's also our responsibility to ensure that patients as well as family members are also following specific isolation protocols. So for PPE and isolation protocol, we learned this in semester 1 in the Fundamental of Healing Arts.
So for our next item, we've chose to do time management. So a symbol of time management is our little nursing watch here. Along with that, we have a couple different techniques that you can use for time management. So we chose this because it can be really difficult as a new nurse or a student to figure out how to manage your time appropriately, especially when you're expected to handle 4 patients as a new nurse graduate. So this is one of the planners that we got from our clinical staff. It just outlines what are the important details you need to take down about each of your patients to keep track of them throughout the day. And another organization which is more in-depth about a patient is this form here, which we used as our care plan in our med-surg theory class, so it's more in depth about one patient and the assessments that you take on them. So we learned about time management throughout all of our clinical rotations, especially this one now. We've realized that you have to really manage your time when you're trying to have multiple clients at one time.
For our 10th artifact, we will be talking about stress management for personal well-being, and our artifact will be represented by a stress ball. So we have broken down some of what we would consider the most important stress management skills. In this, we included physical activity, social relationships, proper nutrition, adequate sleep, and relaxation. Incorporating all of these aspects into your life is important to promote well-being as well as to prevent burnout and fatigue. And as a new nurse graduate, it's really important to establish your coping mechanisms early on to prevent burnout from occurring. Because if you have a better understanding of what you can personally benefit from, it will promote healthy nursing practice.
So we learned about this in our first semester. So our first CNO resource we choose to talk about is leadership. So we have the CNO document here on leadership. So we chose to do this because as student nurses moving towards a new nurse graduate role, we are still not confident leaders. So it is important for a new nurse graduate to recognize this to make improvements to their skills, such as being a role model, collaborating with the healthcare team and other nurses, as well as advocating for their patients. patients. The symbol we have for leadership is a sports medal, which represents leadership.
All right, so for our second CNO standard, we are incorporating culturally sensitive care. So this is very important because we'll be working with clients from all aspects of life, from different cultures, and as nurses we need to be open and understanding to people and their different values. So for our item, I'm including sage and a smudging pot. This just represents a healing practice from the Aboriginal culture. This is just important because we want to help accommodate people's different cultural beliefs and incorporate it into our medical healing as well as their religious or cultural healing practices.
So for our third CNO resource, we chose to do the professional standard of professional relationships. So this incorporates inter and intra-professional relationships, so relationships between nurses and relationships between other healthcare professionals. So why this is important to us is we want to make sure to collaborate with all people among the healthcare team to provide the best care we possibly can for our patients. Why this is important to a new nurse graduate is because as a new nurse, we want to also make sure to collaborate with the care team and get comfortable with this, as that's what we're going to be doing throughout our careers to benefit our patients and provide the best possible care we can. So a symbol of this are our puzzle pieces, as we all want to work together to accomplish a common goal.
Okay, so our next CNO resource is the practice guideline of the RN and RPN practice, scope of practice. So this identifies the framework, what differentiates between the role of an RN and an RPN. So this is outlined by the complexity, predictability, and risk of negative outcomes. As a graduate nurse, this is really important to understand scope of practice and where a patient goes from the RPN scope to the RN scope. So our symbol is a stethoscope. This is for taking vital signs, and vital signs are a really good way to interpret whether a patient is in a stable state or unstable state. So as RPNs, we know that an unstable patient is likely out of our scope of practice, so we need to know when to pass that off to another role. So for our final CNO reference, we are talking about giving and receiving gifts. This falls under the practice standard of therapeutic nurse-client relationship. So we need to understand as new nurse graduates and throughout our career that it's not appropriate to be accepting gifts from patients. Our example here is just something as simple as a TIM card, and we need to understand that we can't be accepting gifts because it crosses therapeutic boundaries and could alter the relationship between a nurse and a client.
In conclusion, through completing this assignment, we now have many skills, resources, and CNO documents that we have collected throughout the whole course of the program to help us make a smooth transition from student to new nurse graduate working in the fields.